Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. First of all, I want to wish you all a safe and happy new year. I want to extend my heartfelt gratitude to our residents for following public health recommendations over the holidays. We appreciate people limiting gatherings, ensuring mask wearing, maintaining physical distance, and getting vaccinated. I also want to acknowledge that it's been challenging to keep up with the pace of change, whether it's regarding testing, isolation, vaccines, travel, or schools. However, we can take comfort knowing that we enter 2022 equipped with much more knowledge about COVID-19 than we did at the start of 2021. And the tools we are using are fundamentally the same: masking, distancing, avoiding gathering, and vaccination. Over the last few weeks, we've learned more about the nature of the Omicron variant. While Omicron may be about half as likely as Delta to cause severe disease enough to require hospitalization, it is 5 times more transmissible. And we know that transmissibility, not severity, is what drives the impact on society and on our health system. Think of Ebola, a disease many times more likely to cause death, but much, much less transmissible. COVID, despite being less severe, has caused so much more illness and death than Ebola because of this transmissibility. Fortunately, we have vaccines. Fully vaccinated individuals may still get Omicron, but are very well protected from hospitalization and death. Those who receive a booster are likely to have much stronger protection against Omicron infection, and so it remains critically important, particularly for those most at risk, to receive a booster dose. We began with those over 70 and now continue to focus on those over 50 years of age. Our booster coverage is now over 60% for 70 plus and 40% for those over 50. In York Region, at the end of last week, we were reporting over 8,000 known active cases of COVID-19, and this is only likely 1/5 of the cases currently circulating in our communities. In Ontario yesterday, there were over 16,000 cases reported, and perhaps as many as 60,000 more unreported. These numbers align with what our modeling predicted, and we expect a continued increase in cases in the coming weeks. In response to this dramatic change in the nature of the pandemic, last week, the province announced significant changes to testing and isolation guidelines. The goal of these changes was to protect the most vulnerable populations and to preserve our healthcare capacity. Unfortunately, we are now also seeing a significant increase in hospitalizations and the beginnings of an increase in ICU admissions. The provincial announcement Monday returns us to a modified Step 2 in the pandemic reopening plan. These more severe circuit breaker measures include deferring non-emergency surgeries and procedures in hospitals and closing restaurants, encouraging work from home, decreased indoor gatherings to 5 people, closing recreational facilities, among many other measures. The province is also closing schools for the next 2 weeks. Please check the Government of Ontario website for further details on these measures. With regards to testing, to allow for continued testing in high-risk settings and for high-risk individuals, the province is limiting access to publicly funded PCR testing. Tests will only be available for those who meet specific medical criteria or are at risk of severe illness from COVID-19. This includes workers and residents in the highest risk settings such as hospitals, long-term care, retirement homes, and congregate living settings. Any York Region resident who's experiencing symptoms consistent with COVID-19 and who does not meet the criteria to access publicly funded PCR testing and does not have access to a rapid antigen test should assume they are infected with COVID-19 and immediately self-isolate to prevent community transmission. With regards to isolation, provincial isolation guidelines have been updated to reflect growing evidence that non-high-risk people with COVID-19 who have been vaccinated do not tend to spread COVID beyond 5 days after they develop symptoms. For this reason, individuals who are fully vaccinated or under the age of 12 will be required to isolate for only 5 days, so long as their symptoms are resolved or improved over the last 24 hours. This does not apply to anyone who is unvaccinated, partially vaccinated, or immunocompromised. These individuals must isolate for the full 10 days from their last exposure to someone with COVID-19, or the date their symptoms began, or their diagnosis date. Detailed instructions on what you and your close contacts need to do if you have COVID-19 or have symptoms can be found at york.ca/COVID-19 positive. Finally, the province has made changes to our response in schools with a focus on maintaining in-person learning. Public health will no longer directly be involved in managing COVID-19 in schools, and cohorts with exposures will no longer be dismissed. These plans may still change. But regardless of when in-person school begins, in this new school environment, it is critically important for students to get vaccinated as soon as possible. Half of children 5 to 11 and almost 90% of 12 to 17-year-olds in York Region have had their first shot. We encourage all families to use these next 2 days off school to take their child to get vaccinated if they haven't already done so. Children 5 years of age and older can walk into any York Region public health clinic to receive a first dose of the vaccine. For clinic locations and hours, please visit york.ca/COVID-19 vaccine. At this time, York Region Public Health supports the latest provincial direction and does not plan to take any further restrictive measures in our schools or our community. We continue to monitor and consider measures based on our local data and the trends we see. That said, with the number of cases we are seeing, York Region Public Health has had to adapt and shift our focus, with case and contact management efforts restricted to only those who are in high-risk settings. Average risk individuals will no longer be receiving a call from York Region Public Health. If you're not in a high-risk setting and you have symptoms of COVID-19 or have had a positive rapid antigen test or a positive PCR test, we are relying on you to notify your household members and other close contacts to follow isolation guidelines and to help curb the spread of Omicron. If you have tested positive on a rapid test, we also have a voluntary and anonymous survey that you can complete to help us understand more about your situation, and it'll provide you with some helpful guidance and information about next steps for you and your close contacts. To learn more, visit york.ca/COVID-19. In York Region, we're making every effort to increase vaccination opportunities, including first, second, and third doses, to ensure that we are protecting the most vulnerable populations at risk of hospitalization should they contract COVID-19. We continue to prioritize vaccinations for children 5 to 11 and those over 50. Booster dose eligibility will be expanded to 18 plus in York Region public health clinics once our more vulnerable groups are adequately protected. I want to note that we are providing Moderna as a booster dose in Ontario at this time. While protection from the Pfizer vaccine decreased dramatically 10 weeks after the third dose in the United Kingdom, the protection from Moderna remains high. This is excellent news for Canadians, Ontarians receiving the Moderna dose. For those 18 to 49-year-olds who are eligible to receive their COVID-19 booster dose at this time, they can book their appointments at participating York Region pharmacies, primary care offices, and other clinics through the provincial vaccination portal. This includes 2 sites located in York Region at the Cornell Community Centre in the city of Markham and a clinic in the town of Newmarket at the Ray Twinney Centre. Please visit york.ca/COVID-19 vaccine for up-to-date vaccination and clinic information and to book an appointment. Or you can do so by calling Access York at 1-877-464-9675. As a reminder, interpretation services are available. I know the start of 2022 sounds a lot like 2021, but I am optimistic. We have effective vaccines providing good protection against severe disease and proven ways to limit the spread of COVID-19. Following the science, in combination with robust community cooperation, will guide us to brighter days ahead. For now, we urge all York Region residents to continue to wear a well-fitting mask, wash your hands, limit gatherings, practice safe physical distancing, and get vaccinated as soon as possible. And of course, stay home when you are sick. As a community and as individuals, we must continue to look out for each other. We have proven that we are resilient and will continue to get through this challenging time. Stay safe, get vaccinated.